Stroke rehabilitation has entered a transformative era, thanks to advances in neuromodulation therapies. The 2021 FDA approval of the Stim paired vagus nerve stimulation (VNS) system marked a pivotal shift from experimental treatments to real-world clinical practice. Unlike traditional therapies, VNS targets the brain's ability to recover by pairing precise neural stimulation with intensive, task-specific training. This approach is especially significant for the nearly 50–60% of stroke survivors who continue to struggle with upper limb impairment months after their stroke. While conventional rehabilitation offers benefits, its effects often plateau, leaving many patients searching for new hope. VNS, by enhancing neuroplasticity, offers a promising adjunct to traditional therapy, potentially reigniting the brain's capacity for adaptation and motor learning. In this video, we'll explore how VNS is reshaping stroke recovery, who it helps, and what the future holds for this innovative therapy. So, how does vagus nerve stimulation actually work to enhance recovery after stroke? The vagus nerve connects to key brain regions involved in neuroplasticity, including the locus coeruleus and basal forebrain. When VNS is paired with specific motor actions during therapy, it triggers the release of important neurochemicals like norepinephrine and acetylcholine. This creates an optimal environment for the brain to reorganize and strengthen connections, especially in areas affected by stroke. Unlike devices used for epilepsy or depression, VNS for stroke is delivered in short, targeted bursts during rehabilitation sessions, not continuously. This timing is crucial. By pairing stimulation with movement, VNS amplifies the effects of each exercise, helping patients achieve greater functional gain. Studies show that this approach can lead to lasting improvements in motor function, even for those who have plateaued with standard therapy. Clinical evidence supporting implantable VNS is robust. The landmark VNS Rehab trial provided high-quality proof that pairing VNS with rehabilitation leads to meaningful improvements in upper limb function for chronic stroke survivors. In this large, multicenter study, nearly half of the patients receiving active VNS achieved significant gains, compared to only a quarter in the control group. Even more encouraging, follow-up studies show that these benefits persist and may even grow over time. Real-world clinical experience echoes these findings. Carefully selected patients who are motivated and able to participate in intensive therapy see substantial improvements in daily activities and quality of life. Integration with occupational therapy, spasticity management, and caregiver support are key factors for success. As a result, VNS is now considered a viable, evidence-based option for patients who have plateaued with conventional rehabilitation. Alongside implantable VNS, researchers are exploring non-invasive transcutaneous approaches that stimulate the vagus nerve through the skin, often at the ear. These methods are attractive because they avoid surgery, but they face challenges with anatomical specificity and protocol standardization. Early studies suggest potential benefits, especially when paired with task-oriented training, but results are mixed due to small sample sizes and inconsistent methodology. Regulatory approval and insurance coverage remain hurdles, and current guidelines recommend reserving these investigational approaches for clinical trials. For now, implantable VNS remains the gold standard, while transcutaneous methods continue to evolve in research settings. Looking ahead, research is focused on optimizing VNS therapy, refining patient selection, stimulation parameters, and integrating new technologies like wearable devices. There's growing interest in expanding VNS applications beyond motor recovery to areas like speech and language rehabilitation. Clinicians, the current recommendation is clear. Consider FDA-approved implantable VNS for patients with chronic stroke and persistent upper limb impairment who have plateaued with standard therapy. Implementation should follow established protocols, with multidisciplinary coordination and patient motivation as key factors. Transcutaneous VNS should be limited to research settings until more evidence is available. As the field advances, VNS stands out as a transformative tool in stroke rehabilitation, offering renewed hope for patients and their families.